Hello, everyone. So glad you're joining us today. We are going to be discussing from bag to patient, leveraging technology to enhance IV line safety, efficiency, and compliance. This is a repeat of one of the booth talks from NTI this year, so I just wanted to bring a little of NTI to our website. My name is Angela Craig, and I am a senior medical manager at Baxter Medical Affairs. I still work at the hospital 1 day a month as a clinical nurse specialist at Cookeville Regional Medical Center, and I am a Sepsis Alliance Advisory Board member. So today we're going to just quickly discuss common barriers to full IV line labeling and complete line tracing and explain how technology-enabled solutions can help address these compliance gaps while reducing unnecessary workflow complexity. We're also going to discuss best practices to help decrease central line associated bloodstream infections, CLABSIs and bloodstream infections, BSIs, and outline how improved labeling and trace processes support these practices. So there is some concerning data. And when you look at the literature out there, IV medication administration remains one of the highest risk processes in acute and critical care. Many times these IV line labeling is incomplete. There's inconsistent line tracing, contributing to preventable medication errors and patient harm. Also, central line associated bloodstream infections and bloodstream infections continue to challenge even top performing hospitals. So, what does the literature say? Well, this particular study was the frequency of intravenous medication administration errors related to smart infusion pumps, a multi hospital observational study. And it showed that over 70% of ICU labels are incomplete or non compliant with hospital policy. Also, when you look at this graph here, you can see that the label's not completed according to policy on that error frequency percentage, 60.1%. And the tubing not tagged according to policy was 35%. Definitely we all need some work in this area. This particular study was intravenous therapy, device labeling in intensive care units, and integrative review showed that pre-designed labels with predefined colors and information help to prevent medication identification errors, and that there is still lack of standardization in the practice of labeling syringes, IV lines, infusion pumps, and solution bags. So let's go with the first objective, how we can identify common barriers to full IV line labeling and complete line tracing, and explain how technology-enabled solutions can help address these compliance gaps and hopefully reduce unnecessary workflow complexity. So what do nurses say about the challenge of handwritten labels? Well, they say many times they're difficult to read. It's time consuming to label a line. Set changes may not occur at the indicated time. Many of these labels are not liquid resistance. We don't have a pen. We don't have time. There's inaccurate or missing information, right? Well, in my experience, and this is just some pictures from my ICU at Cookeville Regional, you can see here that we've got multiple different individual labels here. And it's kind of funny, we got a paper towel roll holder and put it together, and then got all these individual labels so that we could label our line appropriately. You can see here that these are the traditional Monday through Sunday labels that are here. And actually, this looks very organized, which is great. But there's still challenges with this, right? And then here's some other labels that we have as well. Now, when we think about technology, there is technology out there that we can put into practice that can help us. So I was not aware that there are INS has specific standards of practice, and INS is Infusion Nurses Society standards of practice they have out where we should really be labeling under the drip chamber You don't have to label below the pump, but you can. But the two places definitely under the drip chamber, and then also right at the insertion site or at the IV connection. Also, when you think about syringes that are laying around, there really should be very specific information, drug name, diluent, etc. on that. Now, let's talk about the barriers to full line labeling and complete line tracing. This is typically a manual process, right? There's maybe no Sharpie in your pocket or on your badge, right? Sometimes I have a little Sharpie there, and sometimes it comes disconnected. Maybe the patient's unstable, so that's not really the time to label your lines, right? When you're aggressively resuscitating your patient, or maybe you just forgot, or maybe there's a knowledge deficit that the nurse does not know the standards of practice related to labeling of IV lines, et cetera, et cetera, et cetera. Now, let's talk about best practices to help decrease central line associated bloodstream infections and BSIs, and outline how to improve labeling and tracing processes to support the practices of what we've just heard about. So let's review the CLABSI bundle review. This is all the things we should be doing to make sure we're taking care of a patient who has a central line well. Now, what I want to tell you is that we're really moving toward more general, all bloodstream infections, right? Not just central line associated bloodstream infections. And they are looking now at what's called HOB, hospital onset bacteremia. So it's not really going to matter that it's just the central line. It could be any line, right? However, all of these things are very important, but this does happen to be the CLABSI bundle. So you can see hand hygiene, line assessment. We want to get that line out as soon as we can if we're not utilizing or if we don't need a central line. We always want to scrub that hub. Also, we want to do daily antiseptic bathing on these patients who have a central line, securing the device and educating the patient. But I also want to focus, all of these steps are important, but I kind of want to focus on this IV tubing and these dressing changes. So on the IV tubing, changing that IV tubing, the needleless access devices, and all add-on devices such as extension sets and filters need to be done per institution policy. And you want to label that tubing and ensure tubes are within the use by date, right? And then we also want to make sure these dressing changes are done appropriately. This mentions to change that transparent dressing every 7 days and sterile gauze at least every 2 days, and change the dressing more often if it becomes wet, loose, or visibly soiled. Label the dressing with the date and time change or per institution policy. But how many of us have seen sometimes central lines where two IV tubings are not labeled that are going into that central line, or maybe that dressings aren't even labeled? So what does the infusion nursing standard say? You can see these are the standards of practice on this screen. I highly recommend that you get your hands on one of these because they really help you with policy development for lines and for these are all the standards of practice. So what it says is to label all the administration sets, right? Indicate the date of placement on the administration set according to organizational policies, procedures, and or practice guidelines. And it says when there are different access sites or multiple fluid containers, connect to a vascular access device, label the tubing with the route and or medication solution near the connection to the solution container and near the patient's access site. So it's very specific that it needs to be 2 places. I'll be honest, I did not realize that we should have 2 labels. I mean, yeah, you think that just makes sense, but it is really important. And especially in places like the intensive care unit where you have multiple lines, you want to make sure there's not compatibility issues. You want to know what's going in each line. Also, the Institute for Safe Medication Practices, that's called the ISMP, it states the distal ends of all tubing are clearly labeled on patients who are receiving multiple solutions via various routes of administration. So labeling of the distal end of bladder installations, IV, central venous, arterial, epidural, umbilical, and enteral tubing properly identifies relevant access sites. Now, like I showed you on the slide prior, when we put this technology into practice, you can actually have a label under the drip chamber. You can label below the pump. You can label at the IV connection. And then, of course, your syringes, if there are syringes, they should all be appropriate labeled as well. Now, what are consequences to poor line labeling practices? Well, bacterial growth in the IV line, which causes a CLABSI or a bloodstream infection due to the lack of timely tubing change because it was not labeled. When you think about some of the CLABSI data, it's about $48,000 per CLABSI on average. Also, the data is there's inaccurate, incomplete, or inconsistent IV labeling. This can contribute to CLABSI risk, and also the incorrect access site use or incompatibility. So med errors from wrong site administration, as well as med errors from incompatible drugs being administered together. So that is where this line labeling can help very much in these patients. Now, I wanted to share with you this particular poster presentation from AVA in 2025, and you can see the objective was to implement an IV tubing labeling system to enhance bundle compliance, to reduce CLABSI rates, and to ease nursing burden. What they did was it was a 304-bed tertiary teaching hospital, pulmonary and gastrointestinal unit. This was a retrospective pre and post interventional quality improvement project, and they used the PDSA cycles. And they had nurse training on a system use and bundle adherence. And then they looked at their outcomes, primary being CLABSIs on the interventional unit, and secondary being bundle compliance rate, nursing time spent on tubing management, and then they did a data collection. And what they found was their CLABSI rate. One reported CLABSI in the 6 weeks prior to the intervention, 0 CLABSIs reported during the intervention, and bundle compliance, appropriate labeling of tubing on the medication and distal connections improved from 60.70% to 82.2%. Nursing time, there was a reduction in tube labeling time by eliminating 3 steps in the process, and it saved approximately 3,800 RN hours yearly. And then there was a CLABSI savings of about 128,000 during the trial. So 100% of the nurses reported improved workflow and ease of use. And what they did was they brought in a smart IV tubing labeling technology to their hospital. So in conclusion, they found that IV tubing labeling significantly improved bundle compliance by providing visual reminders for timely tube changes, as well as a reduction in CLABSI to align with evidence supporting that bundle adherence, and then time saving, alleviating nursing workload, and addressing staff challenges. And also implications where technology driven solutions can standardize care and enhance patient safety. And also they've been able to sustain their compliance. So in conclusion, there is technology that can help us improve line labeling, CLABSI bundle compliance, and help with nursing burden. If you aren't measuring it, you cannot manage it, right? Just because you don't have a CLABSI issue at this moment doesn't mean you won't. So be proactive instead of reactive. Multiple references are listed here that were used for this information that I just shared with you. And I want to just remind everyone that we do have a medical education website. You can scan the QR code or go to fluidmanagementeducation.com, where it's just loaded with lots of non-promotional education, videos, podcasts, etc. And I just want to thank you for your time. I hope you've enjoyed this presentation. If you have any questions, feel free to reach out to me at Angela_Craig@Baxter.com. Thank you all.